begin.
At the end of the day, whatever happens, happens. No, just go down. Okay. What do you do for a living? What you do for a living? What? They're looking for me. What do you do for a living? Okay. What do you? No, don't look at her. Look at me. All right. Don't touch me. No. Oh my God, you're embarrassing. Come on. Wait, ma'am. Wait, calm down. She's done. Listen, I gotta go to lunch. Thank you. No, just calm down. Just relax. Wait. Oh my God. Oh God. Relax. Don't move. What are you jumping out this boy? Please send this video to me. This is ridiculous. How did you gonna need this video to me? I got the video. It's been in there. Just relax. You cracked that door. You done went all the way out the chair. I told you. I'm telling you. If this needle fall out, that's on you because I'm gonna have to take your head. Oh, you want to chill out? I'll do it. You don't mind. Hey, I'm done. I'm done. You know.
We shared that video because that is the experience of patients around the world. And so we've been tasked with creating a new product for Siemens and their medical group. So for Team 4, we have Derek Holmes, we have Steve Rutherford, and Glenroy Wilson. And our product is called EZ Draw. So EZ Draw is will basically revolutionize the way blood collection is done today. So as I said, the new product group of Siemens asked us to create a new product, and we thought about what product could we create that would really impact not only patients and our direct consumers, but then also assist with the bottom line of Siemens. And we came up with, again, what we call EZD, or EZ Draw. And this is a new way to collect blood. The opportunity is tremendous. The market is huge. It's basically a market that's over $13 billion worldwide. There are nearly 800 million devices that are currently in the marketplace that collect blood, and we intend to take some of that market share. So our mission is simple. So we wanted to create a product that is going to make the blood collection process easier, faster, more efficient, and reduce the anxiety of patients and make their overall experience a much better one. As it was demonstrated in the video, you see men, you see women, you see children. Millions of people are terrified with the thought in the process of getting their blood drawn. The description of the product is actually really fascinating. So it is going to be a product that will be in a sleeve, very similar to like blood pressure cup, something that patients can just wrap around their arm. They won't even see the blood being drawn, and they won't even see it being captured. It will have a sensor that automatically detects the best place, the best vein in order to get the blood drawn from. And then there's a small, very small needle attached. The patient will only feel a slight prick, and the blood will begin to be drawn. There'll be a sterilized tube that goes to a tube where the blood will be collected. Once the blood level is acceptable, then the sensor will recognize that and stop drawing blood, and then alert the practitioner that the procedure is over. So very fast, very quick, very efficient. Again, our value proposition is just to make the process and the experience much more acceptable, much easier, much less pain and anxiety for the patients, and much more efficient for doctors and nurse practitioners. So our SWOT analysis. So when we talk about strengths, weaknesses, opportunities, and threats, I've got several bullet points listed here, and I won't read them all. I will just touch on one point on each box. In strengths, actually a couple in strengths, we think that because this is a new product not seen before, it will catch on like wildfire. And then the other thing that we have going for us is our company's history and success and financial backing. If I go to opportunities, as I mentioned before, it's over a $13 billion market, so there's huge opportunity, and there are a lot of old devices. So if we capture even just a small percentage of the market, it'll pay huge dividends. Weaknesses, I'd say the biggest challenge will be just the old way of doing business, how businesses have done their partnerships with physicians and medical groups and medical companies. Will have to have a mind shift on how they're doing business. Threats, competition, we have to make sure that we keep our products in-house, our products in our plans in-house so they don't get out to market and there's a lot of espionage in medical device. It doesn't seem that way, but there is. And so we have to make sure that we guard against that. And then we also have to make sure that we check all the boxes for the governing bodies. Some of the critical issues will be how well the product works in the market, how it catches in the market, and then among other things, I think it'll come down to our sales and our marketing execution. And now I will turn it over to Darren.
Thanks, Stephen. So in our market analysis, we will cover the macro environment. In Germany, there's 18 million individuals, 3.7 million in Berlin alone. Germany has a universal healthcare system where the citizens are required by law to have health insurance, which draws that population to be able to utilize our product. Our market size and growth, again, as Stephen just said, there's $13 billion in this industry, according to Grandview Research, and it's currently growing at 6.1%. The market trends, Siemens is growing at 24 billion, or growing towards $24 billion. The use of equipment rising globally due to trauma, different diseases, global awareness. So citizens are utilizing these things. According to the CDC in 2013, around 50 million adults were diagnosed with heart disease and cancer-related in the US. 70% of blood collection comes from Europe and North America. Therefore, there's a demand for our product in Germany, and we expect that to continue. Our target markets can be broken down into diagnostics and treatment. As you would sure assume, that diagnostics is the main target there. We will focus on hospitals, clinics, donation centers. Germany also has a really strong blood donating culture. Our customer analysis breakdown is we already know that people will enjoy this product. It's more so about creating a need for the industry. So we will focus on working with the federal government, the Federal Joint Committee in Germany, as well as the public insurance, which services 87% of the country. The need analysis, as you can see from this chart, it's definitely growing and predicted to continue to grow in all facets. Germany currently has the third highest hospital bed count in the world, with a lot of blood donation needs. As I stated before, 70% comes from Europe and the US. And with Germany having that high culture, they are one of the leading countries keeping the blood supply high for the globe. The presence of a highly developed healthcare infrastructure and high per capita healthcare expenditure drive growth in this region. In addition, rapid adoption of advanced products in the U.S. boosts the demand for target products. The competitive analysis, First, we feel that our main competitors would be the other products that are currently used, like the vacuum tube, the wing steel needle, hypodermic single-use needles. Of course, the other companies may try to utilize our product or create something similar. Those companies that are direct competition are GE, Medtronic, and Johnson & Johnson. So GE's competitive advantage is its diverse operating portfolio. Medtronic's is surgical and medical systems. Everyone knows Johnson & Johnson has a strong brand with their Band-Aids, baby products, Tylenol, and surgical innovation. Our indirect competition outside of just the reduce of needing to draw blood would be other products that could utilize other fluids to test for similar lab results, such as urine analysis, sweat, and other lab work. So our strategy.
All right.
We'll start with our market objectives. In year one, we feel confident that we can sell about 40,000 units in Germany. By year 5, we expect to have 75% of Germany's market share. So we really think that we're going to take over based off of our strong brand and financial model that Stephen brought up earlier. And our product is just really going to appeal to the public, so we see no issue with taking over the market. Our financial objectives. Year one, we expect to hit close to 20 million in gross profits. And by year 5, we think that we'll sell 100,000 units annually for about $50 million profit. Our positioning strategy, how to make the blood collection process and make it faster and less painful for patients. At Easy Draw, we try to keep it easy. We think that our name speaks for itself, and these are the aspects that keep us in the stronghold. Our product strategy circles around the customer service and experience. We feel that we know that our product has a 99 or over 99% success rate at hitting the veins when it's drawing. We know that it will reduce patient anxiety because of that, and as well as not having a vein. The auto sensor streamlines the whole process, so the nurse practitioners also are efficient and enjoy the process as well. They can literally throw the sleeve on, start moving on to the next thing. The client doesn't even know what's happening. The price strategy, we chose $499 per unit. The average cost for similar medical products is between $400 and $600. We utilized the distributor influence as well when we came up with this target rate. The distribution strategy, first our direct distribution strategy will be shipping directly. People can order through the website and we will ship it directly to them. But we will also utilize Health and Mirror's global distribution network that's already established. So yes, we're going to start in Berlin, but we do plan on making this a global product. Indirectly, we'll utilize local wholesalers. Our integrated marketing communication strategy, we will send teams out to annual EdTech conference showcases, digital healthcare innovation summit, and the strategic partnerships with physicians. When you think about medical, everybody wants to be clean. And so we utilize this logo with white for its pureness. Blue is the essence of life and represents water. And if you notice the bold letters in our tagline, they represent the different blood types. We make drawing blood easy. For market research, we will focus on consumer research and industry reports. We will ensure we are selling to the correct customer and fueling their needs. Scope and implementation, team of employees interviewing and surveying the users and patients to share the potential customers. and industry reports. We'll utilize those to stay informed. We'll have a team of employees analyzing reports to help improve our business.
All right, and thank you, Derek. We're going to turn it over to Glenroy.
Thank you, Steve, Derek. And now we're going to talk about the financial analysis. The bottom line is this product going to make money? We know it's going to be a great product, and it's going to help a lot of patients who fear needles. It's going to make the process more streamlined, but is it going to make money? And how we determine that is by the break-even analysis. Okay, and in order to get that, we take the unit price $4.99 minus what it costs for us to produce it, $2.99, and we take the fixed costs and divide those two numbers, and what we come out with is 40,000 units. So at 40,000 units, we will be able to break even and make a profit going forward. Okay, the sales forecast. In the first month, as Derek stated, we plan on selling 40,000 units. Second year, that should go up to about 55,000 units. Third year, up to 70,000 units. In the fourth year, 85,000, and finally in the fifth year, 100,000 units to give us a gross profit of 50 million. As far as the expense forecast, a lot of our costs will go into R&D to make sure we have a solid product. With the imaging technology, that's a big part of it. And also, there's a lot of costs associated with getting out to different trade shows and the different medtech conventions, and also getting the product in the hands of the top doctors and nurses and facilities that will utilize it. Okay, implementation and control. Well, we want to create buzz about our product, and this will take place at the medtech conventions and the road show, and also it's going to start to create buzz about it, and there'll be a lot of word of mouth promotion. Since this product is going to be used by hospitals and the medical industry, we're not going to focus on advertising through television or radio or anything like that. We'll definitely use the trade shows, magazines, and then direct marketing. As far as controls, we will use online surveys, seasonal surveys, get feedback directly from the end users as far as how the product is working in the field. Okay. Our marketing organizations, there will be a marketing director, and beneath that director will be the direct contact staff who will go out to the different hospitals and basically showcase our product to get firsthand feedback on how it's doing. There'll also be a website where organizations and the end users can get information, updated information about our product. And one key thing is we're going to have a phlebotomist on staff. Of course, a phlebotomist is a professional who draws blood, and they will basically oversee part of the marketing, because this product will replace a lot of personnel in that industry. The salary for a phlebotomist as of 2015 about 31,000, and that was about 7,000 euros. So that's a big that's added benefit to the organization, because they'll be able to manage their staff by using our product. Okay, now we all expect this phenomenal product to do great. But we also have to plan for contingencies just in case things come up. If the product malfunction, what are we going to do as far as a recall? Or if someone gets injured using our product and we may need to settle a lawsuit, we'll make sure we have funds set aside to handle that situation. If there's change in distribution method, if the product takes off and is exceeding our projected sales, then we need to make some changes to distribution. And so just anything that's going to affect this product, we want to make sure we stay ahead of it and make sure that our product is helping individuals make the blood drawing process more streamlined and easy.
Well, thank you, Glenroy and Derek. That concludes our presentation. We appreciate your time, your consideration. We hope that this plan has been effective and has demonstrated how we will execute and gain market share for our new EZ Draw product. Thank you and have a great day.